Welcome back to AMC Decoded with our high-yield MCQ series question number 12. Before we dive into the case, here is an interesting fact regarding the AMC1 exam. In OBS and gynae questions, brown spotting combined with a closed cervix is a classic trap designed to make you immediately choose threatened miscarriage. However, AMC examiners often hide a specific silent clue in the patient's history that completely rules the diagnosis out. Ignoring this one subtle detail is the most common reasons candidates get this question wrong. Let's see if you can spot that clue in today's scenario. A 29-year-old preemie presents to emergency department at 11 weeks of gestation based on her last menstrual period. She reports a 2-day history of spotting, which she describes as dark brown in color. She mentions that her morning sickness, which was previously severe, has abruptly resolved over the last week. She denies any intense abdominal cramping or the passage of clots. On physical examination, her vital signs are blood pressure is 110/70, heart rate is 78. Abdominal palpation reveals a uterus that is non-tender and fills approximately 8 weeks size. Speculum examination reveals a small amount of old blood in the posterior fornix. The external cervical os is closed. A transvaginal ultrasound is performed, showing a fetal pole with a CRL of 9 mm. No cardiac activity is detected after observation for 30 seconds. Now, the question is, what is the most likely diagnosis? A. Threatened abortion. B. Inevitable abortion. C. Incomplete abortion. D. Missed abortion. Or E. Pregnancy of unknown viability. I want you to pause the video right now and lock in your answers. Option number D, missed abortion, is the correct answer. Based on the findings, the spotting, and the closed cervix, it might look like a threatened abortion. The ultrasound findings of CRL greater than 7 mm with no heartbeat makes the diagnosis definitive. Let's try to decode it. First, the silent clues. The patient's morning sickness resolved abruptly, and the uterus is small for dates, that is 8 week size at 11 weeks. These are the clinical signs that the fetus died weeks ago. Second, the ultrasound criteria. Diagnosis relies on the scan. The Australian as well as the international guidelines state that if the CRL is greater than 7 mm with no cardiac activity, it is a non-viable pregnancy. In this case, the CRL is 9 mm with no heartbeat, confirming the diagnosis of missed abortion. Here is why the other options are incorrect. Option number A, threatened abortion. It is incorrect because a threatened miscarriage requires a viable fetus with a heartbeat. Here, in this question, our fetus is dead. Option number B, inevitable abortion. It is incorrect because the cervix is closed. Inevitable abortion requires a open or dilated cervix. Option number C, incomplete abortion. Incomplete abortion is incorrect because no tissue has passed. The patient, she denies any clots and the cervix is closed. Option number E, pregnancy of unknown viability. This would be the answer only if the CRL was less than 7 mm. Since in the question, the CRL is 9 mm, diagnosis is very clear. For the exam, memorize this keyword table. For threatened abortion, it is bleeding with closed cervix and a viable fetus or viable heartbeat. For inevitable abortion, it is bleeding with open cervix and no tissue is passed. For incomplete abortion, tissue has passed with open cervix and the patient is still bleeding. For missed abortion, no active bleeding, often just brown discharge, a closed cervix, and a dead fetus. Remember this, brown discharge with no fetal heart rate is missed abortion. This image will help to visualize what is happening inside the uterus. For threatened abortion, the cervix is closed and the pregnancy is still attached and viable. For inevitable abortion, you can see the cervix has open or dilated and the pregnancy is detaching. The loss is unavoidable. For incomplete, some tissue has passed, but some products of conception are still retained inside, keeping the cervix open. For missed abortion, the fetus has died, hence no heartbeat, but the cervix remains closed and the body hasn't expelled the tissue yet. To summarize, always check the cervix status and the fetal heart rate. Cervix plus bleeding plus fetal heart rate equals to your diagnosis. Thank you for watching AMC Decoded. Like, share, and subscribe for more high yield AMC content. I'll see you in the next video.